we've all heard of the devastation that this virus can cause, and that's because these receptors, the ACE2 receptors, are on so many of our organs and tissues, like the heart. There are young athletes that have inflammation of the heart, something called myocarditis, and some people that have rhythm disturbances because of it. There can be kidney failure because of the attack of our kidneys where the ACE2 receptors reside, or our liver can sometimes become inflamed and liver failure may occur. Or when the pancreas becomes inflamed, you may develop diabetes. And a small percentage of people go into the hospital with COVID without diabetes, but exit and doing much better, but with diabetes. And it can also attack the intestines and cause abdominal problems, the brain, and cause inflammation of the brain called encephalitis, which can be devastating. There's about an 80% death rate if the brain is highly inflamed from this virus. And what we all hear about is when it attacks the lungs and can cause a severe, often fatal condition called acute respiratory distress syndrome, because there are lots of these receptors in the lung and it tends to enter from the upper airway. Next slide. And so this is a cartoon that shows the vaccine. And the vaccine actually had been under study for several years. Some people think this all came about in 1 year, but messenger RNA has been studied for almost 20 years. It's just they were able to make advances. And so some very smart researchers found that if they enclose this in a lipid envelope, a tiny bubble of fat, if they enclose the messenger RNA that just has the message to make the spike protein, people can become immunized once it gets into the cell and does much like the virus does and makes just the spike protein. But this does not go into the nucleus. It just goes into that cytoplasmic area, that's the area outside the nucleus, and makes spike protein that can then be presented to our immune system.